That has yielded positive results, and such results are as follows. 1. More than 2.4 million have been screened for COVID-19. More than 59,000 people have been tested. 1,498 confirmed positive cases. 806 recoveries. Now, if you look on that, the percentage is about 60% of recoveries. So it means that there is work that is being done. Sadly, we have lost 45 people as the province. With our bed occupancy in ICU sitting at 1.1 of the available ICU beds. The number of recoveries is increasing, and we're pleased to see this trend. We have managed to prepare more than 6,400 beds for isolation, quarantine, high care, and ICU throughout the province, with each and every district well represented in this regard. So our capacity to accommodate patients has increased, and I think we are now confident that we are not going to be overwhelmed by this pandemic. Last week, when we spoke here, we had 608 people who had recovered. We had 38 patients in private facilities and 64 in public. We had 40 deaths. This week, the number of recoveries stand at 806. Those recoveries give us hope that indeed COVID-19 can be defeated. That being said, we continue to see an incline in terms of positive cases, but it is comforting that the number of recoveries is also rising. We are working extremely hard to defeat and decrease the number of active cases. So each and every time we see, we would want to get active cases, more recoveries, so that we are able to defeat this pandemic. If you then juxtapose this against where we were in March, the bulk of the cases were in eThekwini and uMgungundlovu, meaning that the pandemic showed an urban-based profile. But subsequent to that, we saw iLembe district overtaking uMgungundlovu. This speaks to the rising cases of local-to-local transmission. What is new today about this pandemic that we want to share with you is that the important trends compared to where we were 2 months ago. And that reflection is as follows. On the 16th May 2020, KwaZulu-Natal recorded 17 new cases. The province is currently, as of today, sitting at 10% in terms of active cases and has moved down to position 4 in terms of highest provinces in the country as a whole. While the majority of the new cases are still coming from eThekwini and iLembe district in a main has recorded more cases per 100,000 people infected if you consider the population size of that district. So the size of the district and the number of infections shows that there is more work to be done with regard to iLembe district. A trend we are worried about, and we are working to stop this situation. While areas that were affected more were initially urban areas, we now note an increase in townships and still less of the increase in the rural areas. We need to work more to curb the spread in eThekwini, iLembe, and uMgungundlovu. And these are to be closely monitored as we go forward. eThekwini has right now 866 of the province's positive cases, followed by Ilembe at 326 and Umgungundlovu at 64. We have a breakdown there that talks to each district, the new cases, the total patients, and as well as the deaths that we have seen in the province. So in terms of the new cases, I think we have reported about that we are now at, in terms of the total, 1,373. Now, while we report 45 deaths in the province, there was no death on the 16th of May. And why we are mentioning this is that we have been reporting deaths daily, and in some cases, the numbers will be 2 or more. We have noted that that cluster infections occurred in some workplaces, especially the retail shops, bakeries, companies, and healthcare settings. The recent one is a depot in eThekwini, where 39 cases were reported and 5 have recovered. 6 of the province's districts have not reported a new case for the past 15 days. So 6 districts have not reported any case in the past 15 days, and that is important for us. With regard to Inanda Community Healthcare Center, following the positive testing of 4 of our nurses, 4 nurses there in Inanda and 1 doctor, the department took a decision to close the facility. This was done as a safety precaution and to allow for the decontamination of the health facility in accordance with the established protocol. We have since tested all employees for COVID-19, and their results are being conveyed to them on a continuous basis. So far, there have been no new positive case from that facility. Employees who test negative will then be allowed to return to work after a period of quarantine. If any one of them test positive, they will not return to work until they test negative. In the interim, surrounding clinics have been alerted so that they accept patients from Inanda. To mitigate the impact of this situation and ensure continued healthcare service provision, we have roped in mobile clinics from KwaMashu as well as Tongat to service the community of Inanda. With regard to General Kizenga Mpanza Regional Hospital, this hospital will be opened from the 18th of May 2020. The hospital was temporarily closed following the positive testing of 9 mothers, 42 staff members and babies, as well as hospital staff. We wish to thank the people of Greater KwaDukuza for their patience and cooperation while this facility remained closed. We also extend our gratitude to the personnel who had to be deployed outside these facilities for serving the day and ensuring that our people continue having an access to primary health care services. With regard to the protective personal equipment, as the province of KwaZulu-Natal, we have adequate PPE stock at every facility, enough to cope with a demand for more than a month. At this stage, we can confirm that we have no shortage of PPE. As a province, we have put in place a highly effective mechanism to monitor stock available and ensure adequate replenishment thereof where necessary. With regard to the issue of the social relief of distress, food security has been one of the central focus during this period of the lockdown. We have to date supported over thousands of vulnerable families with food relief program. We are also aware that the majority of our unemployed people in KwaZulu-Natal have applied for the unemployment support grant that will be made available for the next 6 months. With regard to preparing for level 3, the province is preparing itself for the level 3 lockdown as per the President's announcement that he is consulting upon. The level 3 means more business and more business sectors will be opened. There will be also the opening up of public transport, but that will require that we remain vigilant and focused and accountable. So all people, as we move to level 3, will still be expected to ensure that they adhere to precautionary measures that have been put in place. That will include social distancing even in public transport. It will include washing of hands and sanitization and all of those, wearing of masks and all of those initiatives. There are strong indications that as KwaZulu-Natal, all our regions may move to level 3. However, there is a caveat for that to happen and remain that way. Everyone will have to comply with all the non-pharmaceutical approaches to prevent infections. So all our people will be expected to ensure that they all follow and comply with measures that will be put in place to ensure that we prevent infections. With regard to the approach of preventing the spread, the use of Operation Sukuma Sake, there are key guidelines and conditions that are in place. Everyone will need to wear a mask when venturing out in public. Our high-risk regions in terms of our risk and vulnerable analysis must be strongly examined before the end of May. Level 3 comes with a lot of movements, including inter-provincial travel. This means that our rural areas where most of our elders live may start to be exposed to the virus. As we prepare to ease the economy further, all businesses, government facilities, municipalities must have in place measures to prevent the spread of the virus and protect the people. The citizens, the business, civic society, government have to work together to ensure that we all adhere to the regulations. All businesses have to be sanitized. They must be proved that social distancing can occur in the place of work and in public. Sanitization and hand washing facilities for consumers and staff must be available. This week, we will inspect the readiness of all sectors to move to level 3. We will need to ensure and need to manage the hotspots together, and the whole of government, civil society, business need to work together as part of Operation Sukuma Sake, which we have integrated into the district development model. So our emphasis is that the district development model, when it comes to the district level, must be at the center of ensuring the link of all sectors Business must not just demand opening. They must demand opening but put in place measures to prevent the spread. They must show us that indeed social distancing will be there. They must prove that people will be able to wash hands regularly. They must prove that there will be mechanism for sanitization. And in some cases, other companies, those that can avail public transport, that the companies that can transport their people, that will be also welcome because it is better, places the lives of the people more protected. And that's why we are saying moving to level 3 will need all sectors to ensure contribution. It's not a matter of saying let's go to level 3, then we move to level 3, then we work as if things are normal. At level 3, hotspots will be in a particular area, a particular ward, particular local municipality and district. The war rooms, task teams working will be, task teams will have to drive the behavior of our community. We must drive the behavioral change in communities. So people must know the manner in which we live and the manner in which we behave has to change. Contact tracing, screening, and positive and testing will have to be a focus of each and every place. And therefore, accountability and oversight will be a responsibility of all of us as we continue going forward. This targeted approach means our Sukuma Sake strategy and structures have to be functional from the ward level, the war rooms, and the district. The lowering of infection and our ability to manage outbreak, especially as more people will return to work, will be strictly monitored. Intensified screening and testing at every public facility, daily education and awareness campaigns, and the preparedness to manage all new cases that may arise will be key in determining the levels in the provincial district. We will believe that the entire province should move to level 3, that we should act fast if we see a district where there are concerning trends that emerges. So the whole of KwaZulu-Natal should move to level 3. But where there are concerning trends, we will have to intervene quickly. We urge everyone to play their part. It is in our hands to curb the spread of the virus through the change in our attitude and behavior. We must remind the people of KwaZulu-Natal that the fight against COVID-19 is for all of us. It is the responsibility of all to ensure that through our behavior and attitude, this war can be won. With that, we wish to thank you for your attendance.
Thank you very much, Honourable Premier. Colleagues, can we take the questions, clarity? As always, Eyewitness News will go first. Can I have another show of hands? So, Eyewitness News. See you, yes. Telema Bricks, the press. Okay, there's another hand here, the third one. Fourth one, Kakas. In that order, please.
Hi, Premier. My name is Koskona Tuma from Eyewitness News. I just have one question for the MEC and one question for you. MEC, with the recovery rate of 60%, which is higher than the national average of about 42%, what lessons are you drawing from your self-isolation and quarantine program as we prepare for the peak? Do you think that it has worked? What has worked in keeping people at home, and how are you going to make sure that as we experience more cases that you continue under this trend? Also, we heard rumors that the peak numbers are actually being revised. So can you confirm to us what the province is really planning for in terms of people that might get infected, and how many of those people do you expect to be hospitalized? And Premier, this question is to deal with the education sector, because the MEC is not here, but I think it is appropriate that I should ask this from you. The MEC for Education, Mr. KwaZulu-Natal, previously said that the province will need about 1 billion rand to ensure that there's safety throughout the academic year. It's not clear if that money has been received from national government. Can you confirm if that money has been received? And if it has not been received, what consequences will the province suffer if that money is not received by the 1st of June, which is the touted date for the schools to gradually start reopening?
Okay, next colleague. Yeah. Kakasi, go ahead. Yes, it was you, and then you come after Kakasi. Yeah.
My question is with regard to the Premier has mentioned that the clinic at Nenda has been closed. I heard also that the police station has been closed. The police station is opened as yet. Also, with regard to the MEC, to the case that was reported in Monori River, or rather Moingofana local municipality, it was said that could have been a false alarm, and that the patient that was said to be positive there, who was said to be the first patient to be diagnosed positive, wasn't actually positive, and that also the police station that side was closed. And can you give clarity to that, please?
Okay, Jonathan.
Hi, it's Jonathan from Daily Maverick. My question is really about the fishermen. Subsistence fishermen and rock and surf anglers obviously are wanting to get back into the sea. Will level 3 allow them to? I know obviously the commercial, the big players can get in, but certainly the everyday fishermen who don't get their shad season after all, try to catch something. When are they going to be allowed back in the water? Thank you.
Okay. Was it you, Sheila?
Okay. Ngiyabonga. Khona into engingayizwanga kahle uNdlunkulu eyisho engicela ukuthi ngizwe kahle. Ukhuluma indaba yelokhuzane njengoba kusiya ku-level 3, there will be into ye-interprovincial traveling. Ngizwanga kahle. Bengifisa nje ukuqinisekiseke ukuthi engizwe kahle.
Okay. I think that will be the question.
No, thanks. I think I will take just 3 questions and then the rest will go to the MEC. Firstly, on the education as a sector, they do need a lot of money, as the MEC indicated. We have escalated that matter to the national government. And the national government is working on that. We raised it with the president and we raised it with the National Command Council. And therefore, we will be expecting the national government to lead us on that. They've not yet responded. But when schools open on the 1st of June, you will have, for a high school or a secondary, you will have only grade 12. And for that period, they will have enough space, enough classes, enough space to ensure social distancing. The whole school will be for 1 grade at that time. And that will be also helping us to build more capacity and prepare ourselves for other grades to come back. That is the same also with regard to grade 7. They will have the whole school for them for that month. So plans are being prepared, and we will continue to prepare as we go forward. With regard to fishermen and all of that, we think they are one of those who are critical to be allowed to come back when we go to level 3. So I think they will be considered as part of that. With regard to inter-provincial travel, it means people will be able to move from one district to the other, and that will be allowed, and it will mean more people in our rural areas will be able to move from one district to the other district, and people from township to move from cities to rural areas. And we're raising that point in relation to the elderly people, those who are old, who are more vulnerable. So as people move from one area to the other, we should ensure that the issue of the spread is considered, and therefore there should be mitigating factors in that effect, in that regard. Thanks.
Thank you. Thank you, Honourable Premier.
Good afternoon, ladies and gentlemen. Good afternoon, Premier, and thank you for that report. Thank you for the questions. Let me start with Nkos Kona's questions. I think those are the ones that might have a bit. Can you hear me? Yes. Okay. Those are the ones that can have a bit of detail. What lessons have we learned from our numbers? Look, the protocols currently were allowing the department and medical field generally to allow patients to self-isolate and self-quarantine. However, you would remember that in one of our media briefings, we indicated that we believe that self-quarantining really on its own is not sufficient. Self-isolation is not sufficient because sometimes we allow people who might have the capacity to self-isolate and self-quarantine, but don't actually do it. So we think that our firm stance on the isolation and quarantining by the facilities might have assisted. Of course, we didn't quarantine and isolate everyone, and we didn't use that as a blanket approach. However, for a person to be able to be allowed to self-quarantine or self-isolate, the department had to go and look at the area where they live and make sure that it's actually doable. In other instances or in other provinces, you would find that there are people who would have been allowed to go and self-isolate or self-quarantine when the environment that they live in was not feasible. And I think there's one case like that in the Western Cape. So we decided that we are going to make sure that we are tight on our protocols, and whoever is allowed to isolate or quarantine is someone that we are sure that they're going to be able to do that, and they do it properly. So we think that might have been one of the lessons that we learned. The other thing that we think could have been lessons is the fact that immediately after the days, after the 5th of March, and we got our first patient, we decided to then go to the floor and make sure that we have enough beds that are both for quarantine and isolation, which then gave us enough time to work. The intention of the lockdown was to ensure that the government has enough capacity to treat people once the peak comes. So the lockdown was never meant to do away with infections, because that's not possible. But the intention of the lockdown was to ensure that when the peak comes and the big numbers come, as government, we have the capacity and we are ready. And right now we do have the capacity and we are ready. And we are ready in all the districts. So we believe the lockdown has really bought us much needed time. But the lockdown has also increased the rate of infection, because it then got people to sit at home who might have been infectious at the time and didn't need to move around and didn't actually do so. So we are quite happy about that, and while we appreciate that the numbers are going to go steadily go up once the lockdown is then taken down to the next level, but we believe we are ready for it. What are the new numbers that are being revised? Yes, there is a scientific work that is being done, and as soon as we have something tangible, we are going to present it. Let me also indicate that while National is working on their own, but as a province, we are also having our own program instructed by the Premier to say, can we make a proper scientific analysis on what we have learned and what do we need to do moving forward with our cases. So we are working on that, and by next week we are going to have a proper report that's going to be presented. The good thing about this work that we are doing is that the team that's working on it's a formidable team. It's a team that one of them is the Vice Chancellor of KZN and a few others. We've got epidemiologists, we have a virologist within our team. So we are quite happy with the work that they are doing, and by the time they give us the work, at least that work will also guide the provincial government on how it must prepare itself for the level 3 lockdown, because while we are sitting here, we are sure that the level 3 lockdown is going to come with its own complications, but we need to be ready. And the spread or the stoppage of the transmission is going to depend on the readiness of government right now. So that's what that kind of work is going to do for us. In relation to the Moyi River case, let me first start by saying, and this is the issue that the Premier raised in last week's briefing, there are no councillors that have the right to go out and confirm or deny cases. And this is an issue that we have been raising and has been talking to our colleagues and comrades about. The Premier indicated this. I'm raising this in particular because in Moyi River, before we could even talk about it as the Department of Health, councillors were making voice notes, were making videos confirming a case and saying there is a case in the area. We must indicate that that is something that is extremely illegal, because while we are dealing with COVID, but the rights of patients are still protected. Now, if we would go out and start making announcements as it has been done, it really goes against the constitution of our country. So we are emphasizing again that can we stop doing that? And I mean, our people have stopped doing it. We don't understand why leaders at that particular level should actually do it themselves. So we are making a call that people should stop. And you would have noticed that when we issue cases, we say there is a case in a district. And we might say there is a case in eThekwini and there are cases in eThekwini because we want to protect the rights of those people. Now, can you imagine we come here and confirm that there's a case and everybody already knows that Unomakuku is positive because someone has said Nomakuku is positive. Having said that, there is absolutely nothing wrong with me coming out and saying I have been found positive for coronavirus and I'm in isolation and I'm recovering. But that should be something that I, as a patient, be given the authority to actually say, because it is my right. The worry with this particular issue is the issue of stigmatization. If we continue with stigmatizing people who have been found to be positive, it means this is a problem that as the province we are going to continuously have. Remember, when scientists were speaking to us together with the minister, we were told that at least 60 to 70% of us, all of us, are going to be infected with the virus at one point or the other. So it's important that we speak to our people and they understand the fact that even being positive should not be a case. Now, I do not want to confirm, not deny, Bongane, whether there was a case in Moyi River. The confirmation that we are giving you is the numbers that the Premier has given that are indicating that we have had a rise of cases in Umgungundlovu as a district, and that is how we treat cases that are positive. Thank you. I think I've spoken to all of them. Oh, having said that, sorry, Mabas, I also want to just explain one thing. There is something that is often called false positive cases, and I think that's what Ubongane was talking to. Sometimes it happens that a patient is tested right towards the end of their infection, and when they, maybe on the 14th day or the 15th day, and initially they are found to be positive, but when we go back and test, we find find that the person is not positive anymore. That sometimes can be referred to as a false positive, but sometimes it happens that when you are tested, you are not, the specimen is not taken properly within your mouth, and then it often gives a false positive as well. I just thought I needed to explain that, because from time to time, you are correct, we will be getting cases that are said to be positive, but when we go in depth, we find that actually they are not positive. It's just how the specimen was taken. Thanks, Mouse.
Thank you very much. Can I take the last round of questions? Number one in this room. Number two, dependent. Okay. Yeah, in that order.
Good afternoon, Brenda from National Africa. I'd like to know, we've spoken about bed capacity and we are on the increase in that. But what about our equipment? Do we have enough ventilators going forward, especially as we're seeing an increase in numbers? And then I'd like to know, we have this team together, a scientific team. Has there been interest in any cases, has there been interest in any cases or lessons going forward from an international perspective in KZN or South Africa that you know of, that you can tell us? What's our relationship like with the rest of the world in learning how to combat this virus? And also just an update on funding in the health department. Are we, still on the easy there with regards to funding?
Funding.
Okay. Independent?
My question is pretty much around the stats. Has the KZN government considered giving out stats and figures which are very specific in terms of, for example, in eThekwini, like KwaMashu has so many cases, Umlazi has so many cases, etc.
Thank you. Request the MEC to respond and then invite the Premier to wrap up for us. Thank you.
Okay. No, thank you, Mr. Mabaso. Thank you for those two questions. Do we have enough equipment so far, particularly your ventilators and the big equipment that you might need in your ICU and so forth? At this point, not yet. We are busy accumulating and ensuring that as soon as we finish the facilities that will need that kind of equipment, we get them moving forward. The department has decided to take a two-pronged approach. We are buying ventilators, but we are also buying something that is called CPAPs. So the clinicians are going to utilize those as and when they deem fit, according to the patient and the level of sickness of that particular patient. I must indicate that we have ordered close to 200 ventilators as a province. Of course, it takes a while now to get those because we have to get them from overseas, but we have received 150 donations. 50 of those are coming from the USA, and we are told they are going to be here in the next couple of weeks. The other 100 is coming from the Solidarity Fund, and those are going to be with us in about 4 to 6 weeks, we are told. So we are waiting for those, but we also have our own that we have ordered. Of course, we have ventilators that we have had and we had bought as a department in different facilities, and we are then ensuring that whatever we have now will add in those facilities, but the majority of them are also going to go to the field hospitals that we are creating. So we've got a few equipment that we have ordered that we are still awaiting, and we'll be adding on the work that we have. Are we talking to the international world? We are talking to the international world, but we talk to the international world through the minister. Remember, we are not a federal country, so as a country, everything that we do or we engage with the international world, we have to do it through the national government. So there is that liaison that is there. About a month back, the minister organized a session between himself, the MECs, and the government of China. And in that particular session, we had a very thorough engagement on what they went through and what were their experiences. And we were also given an opportunity as the different MECs and HODs to ask questions on a few areas that we didn't have clarity on. Because remember, while this virus is about 2 months or 3 months old, but they have been exposed to it longer than us. So we had that opportunity, and the minister continues to engage different countries so that we are able to learn from them. I must just also indicate that the Cuban doctors are arriving in the province of KwaZulu-Natal today, but the Premier is going to be welcoming them towards the end of the week and then deploying them to the different districts, because when they come, there's 28 of them, when they come they will then be sent to the different districts, and the Premier is going to do this for us on Thursday. I'm saying this because I know we are not going to be taking questions, but when we invite you to that particular program, you would have at least got that indication. Now, that is part of the international work and engagement that we are having as a country moving forward. The question was, are we going to issue statistics? We have issued statistics of eThekwini, and we've indicated that eThekwini there's 946 infected cases, and so far that is where we are willing to go. So that we don't want, again, the issue of stigma becomes a problem. We don't want people of eThekwini to start thinking just because one lives KwaMakhuta, omunye uhlala eMlazi, therefore it's only abantu baseMlazi and not abantu bakwaMakhuta who are exposed. Everyone who lives in eThekwini must be careful, and everyone who lives in eThekwini must understand that that particular district is a hotspot. Ilembe is becoming another hotspot. We want the people of Ilembe, all of them, to speak to understand. Let me just indicate that when you look at the clusters of infections that we have in eThekwini, there is no way you can say one particular area is a hotspot, purely on the basis that the majority of the people of eThekwini, they all work in one city center. And our clusters, we have found them to be in the work environment more than anywhere else. So as they go to work, they go back home, and the infection is taken home, and it will be taken to Emlazi, KwaMashu, Enanda, the rural areas of eThekwini, and the same thing is happening in Ilembe. So now that we've decided that Ilembe is also a hotspot, it's Ilembe as a district that is a hotspot, because if you start saying you have so many people in KwaDukuza but not in KwaMaphulo and in KwaMaphumulo, and yet all the people of Ilembe, they work in one particular center, then we are going to really be fooling ourselves. Thank you very much, Dr. Magas.
Thank you, MC. We invite the Honorable Premier to also wrap up in Zulu. Over to you.
Thank you, Mr. Mabaso and MEC. Siyafisa ukubonga kunina nonke enila namuhla. Okokuqala nje okubalekile ukuthi sibheke ukuthi ngakube i-lockdown le ebekhona kumbe esekhona isebenzele ngendlela njengekwaZulu-Natal nanjenge-South Africa. And i-assessment yethu ithi i-lockdown isilekelele kakhulu ekukwazini ukuthi sidile nawo wonke ama-cases akhona, kodwa la esilekelele kakhulu khona ukuthi sikwazi ukuthi sibe nokuzilungiselela ekutheni sibhekana kanjani nalesifo. Sizilungiselele ngokuthi abahlengikazi nodokotela nabasebenzi bonke abakwezempilo bakwazi ukuthi babe prepared ukudila nalesifo. But two, sikwazi ukwakha indlela yokuthi sibe necapacity, kushuthi sibe nawo umthamo othethuthu wokwazi ukuthatha abantu ezibhedlela abaphethwe yilesifo. So umubheka nje ngokwamanje kulesi sikhathi besikuso sikwazile ukutesta abantu, shuthi sihlole abantu, and siscreene abantu abangu 2.4 million sikwaze ukubascreena. Sakwazi ukutesta abantu abangu 59,000. Sakwazi ukuthi njengamanje ama cases are confirmed awu 1,498. Ama recoveries angu-806. Kodwa okusho ukuthi ama-recoveries abantu abaphilayo ababangcono baphile kutestwe kutholakala ukuthi abasenaso lesifo kuya ngokunyuka inamba yabo la KwaZulu-Natal. Uma ubheka nje i-above 60% wabantu abanjani abasindayo, so sesino more than 60% wabantu abasindayo uthola ukuthi abasenaso lesi sifo. Noma kunjalo kusiphethe kabuhlungu ukuthi abantu abangu-45 baluze impilo zabo ngalesi sikhathi. Ngiyafisa ukuqinisekisa ukuthi njengekwaZulu-Natal for lesi sifo sesikwaze ukuthi silungise imbhede engu-6,400 for isolation, quarantining, high care and ICU. So imbhede engu-6,400 isiredi iseyindaweni eyihlukahlukene. Ayikho district la esingenakho khona imbhede reserved for abantu abaphethwe isifo se-COVID-19. Siyafisa futhi ukuthi sigcizelele ukuthi lesi sifo sikubona wonke ama-district. Kodwa into esiphethe kabi kakhulu yiTheku, iKwaDukuza, iLembe lilonke noMgungundlovu. Kodwa iLembe ilona elikhombisa izibalo eziyaphezulu kakhulu. Uma ubala abantu abahlala khona nje ngokwepopulation nabantu abatestwe positive uyabona ukuthi izinga lokutheleleka liphezulu. Ingakho ke sithi kumele sidile nalezi ndawo. Ngokwesibalo sisonke abantu abarecovayo baningi kakhulu. So siyafuna ukuthi sikubonge lokho and siyafuna ukugcizelela uma kuyiwa ku level 3 njengekwaZulu-Natal sithi zonke indawo zaKwaZulu-Natal kumele ziye ku level 3. Kodwa noma kunjalo yonke inkampani evulayo kumele ikulungele ukuthi izovula kuphela uma isiqale yaklina ngaphakathi, yenza sure ukuthi ngaphakathi kudecontaminatwe ngendlela, kodwa futhi ibeke ama-measures, izindlela zokuthi abantu bavikeleke. Lokhu kuyosho ukuthi ama-sanitizers akhona, abasebenzi baprovidwe ngama-mask, abantu iy'ndawo zokuwasha izandla ngensipho namanzi njalo zilungiswe. Futhi inkampani kumele ithi mivula ibiyazi iplan ye-transport yabantu abasebenzayo. Uma kuyi-public transport akubhekwe ukuthi leyo public transport is-safe and 2 abantu bayayilandela i-social distancing. Uma kungukuthi inkampani ezobithutha abantu ibalethe emsebenzini nalokho kuyomukeleka, kodwa kuyodinga siqikekele ukuthi konke okwenziwayo kwenziwa ngendlela. Zikhona izikhungo zethu sihulumeni ebeyivaliwe neyisavaliwe. Eyokuqala iNanda Community Health Care Center evalwe emva kokuthi kube nonesi abane nodokotela oyedwa batheste positive. Sibafisela ukululama ngokusheshsha ibe sivalwa kodwa izovulwa maduze iNanda Community Health Care Center. Okwesikhashana besasebenzisa amaklinika aseduze nama-mobile units asuka kaMashu nasuka Othongathi. Eyesibili iGeneral Gizenge Mpanza Regional Hospital okuyisibhedlela esilapha kwaDukuza. Siyafisa ukusho ukuthi sizovulwa kusukela kusasa, siyavulwa. I-consultation yonke isiyenziwe. Siyafisa ukubonga kubantu bakwaDukuza ngokubambisana nathi ngalesi sikhathi singuhulumeni. Siyafisa ukubonga abahlengikazi bonke abaye baqinisekisa ukuthi abahlengikazi nodokotela abaqinisekisile ukuthi uma kunabantu abafikayo bayalekelelwa ey'ndaweni eziseduze ukuze kungathi ngoba izibhedlela zivaliwe abantu bayithole bengesenakho ukuthola usizo. Siyafisa ukuqinisekisa ukuthi through umnyango wezempilo under MEC umama nomagugu Simelane Zulu yonke indawo ibhedlela zinakho lokhu okubizwa ngama PPEs, the protective personal equipment, zikhona, kunesitoko esanele. Kodwa futhi siyazi ukuthi enye yeinkinga esisibe nayo isidingo sokunikezela ukudla ebantwini. Sihulumeni siyawusebenza lo msebenzi wokuthi bonke abantu bakuthole okudliwayo. Ziningi kakhulu maningi amakhaya esesiwalekelelile futhi siyaqhubeka. Indlela yokwenza ukuregister through social development or through ama war rooms namakhansela. Siyafisa ukuthi kungabibikho umuntu obekwa eceleni ngenxa yokuthi yena either usupport ubani o ngenxa yani yokuhluka kwembono. Umuntu mawukuthi akalithola usizo, akangalithola usizo kube ukuthi yingoba engaqualify. Kungabi ukuthi nje ubekwe eceleni ngenxa yokuthi mhlambe akahambisani nabalapho abaholayo. Siyafisa ukuthi ke sigcizelele ukuthi ukulwa lempi kuzosidinga sonke. Ukulwa impi siyinqobe le COVID-19 kudinga thina suhulumeni, osomabhizinisi, ngokunjalo neinhlangano neinhlaka zomphakathi zonke sibamsane. Uma socabanga ukuthi kuya ku level 3 kuzosolve inkinga, mase sizenzela nje sizoba nezinkinga ezinkulu. Kodwa uma sibamsana sonke silandela imigomo sizophumelela. Into ebaluleke kakhulu ukufundisa abantu bangithi indlela entsha yokuphila. Indlela entsha yokuphila isho ukuthi umuntu nomuntu makafake imask. Indlela entsha yokuphila isho ukuthi asibe ne-social distance between umuntu nomuntu. Indlela entsha yokuphila isho ukuthi uma ukhwehlela noma uthimula, uma ungayifakile imask, sebenzisa indololwane uthimlele khona. But also kusho ukuthi isikhathi nesikhathi kudinga siwashe izandla ngamanzi nensipho. Uma siqikekela ukulandela lemigomo sizolehlisa izinga lani lokutheleleka kwabantu ngalesi sifo. Masibamsaneni sonke sikwazi ukuthi sinqobe lempi yalolu khuvethe le COVID-19. Siyabonga.
Thank you very much, colleagues. We adjourn at this point until tomorrow. We will receive the paper train, which is converted now into a mobile testing train for COVID-19. Is going to be boosting our efforts in the fight against the COVID-19 pandemic. So we're inviting you to the paper train arrival tomorrow. We'll give you all the details, and then on Thursday, as the MEC indicated,
we come out to those pictures live from Durban, of course being the Premier of KwaZulu-Natal, Sihle Zikalala, speaking about the state of readiness heading into level 3, as it were. He began off by speaking about the more businesses, the business sector that's expected to open more people in public transport. He spoke importantly about establishing a war room ahead of level 3. This, of course, to try and guide the people of KwaZulu-Natal in terms of the new restrictions and how they're going to be handling that. Possibly just important to come out of that, what we did come out of that is the fact that some of the districts that he mentioned with the number of infection rates, the districts, the high level of districts, the top 3 is eThekwini with 866 infections, Ilambe districts 326, Pietermaritzburg, Umgungundlovu with 64 infections. Remember, Pietermaritzburg, in fact, Hilton, just outside of Pietermaritzburg, was where the first case of COVID-19 was detected in South Africa. There was patient 0 on the 5th of March 2020. The Premier also spoke about the implementation of mass screening. We saw the numbers, good numbers he spoke about. 2.4 million people have been screened in his province, about 59,000 tests for COVID-19, and reported 1,498 cases. He did speak, though, about the importance of the recovery rate, which currently stands at 60%, and 45 deaths coming from that province. That is the Premier of KwaZulu-Natal, Sihle Zikalala, and MEC of Health in the province, Nomakhoko Smilani, was speaking also, importantly, the ordering of 200 ventilators for the province, received 150 donations so far, 50 coming from the USA, expecting a couple more in the next couple of weeks. We'll take a quick break right here from our studios out at Nasrec. When you return...